बिन आपके लगता नहीं.
Mental illness is the most stigmatized of illnesses globally. In our country, a person suffering from any mental health issue is loosely called pagal or thought to be possessed by a bhoot or pret, an evil spirit. This is why mental illness is kept hidden as a dark, dirty secret from the outside world.
लगता नहीं दिल.
It is a very rare person indeed who can talk openly about it.
आपके जिए तो जिए कैसे.
Elder daughter has been suffering from schizophrenia since her childhood, which we did not diagnose at a very early age. Behavior also, didn't look normal. But nobody suggested that we should go to a psychiatrist. Maybe the child can also be treated by a psychiatrist. We didn't know that. She has been suffering. May I say, we both have been suffering. When she suffers, I suffer too. Every moment of my life, she's been the focus. Although I've got my teaching program, I'm into theatre, I've been acting, directing, doing many things, but above all, always has been my daughter, the focus of my life. She has suffered too much. She suffered in my womb because my husband was very violent and he would hit me. And I also used to get infuriated because it was such a blow to me that a man whom I knew before marriage, who used to adore me, who used to write letters to me twice a day, उन दोनों में दो बार डाक आया करती थी सुबह शाम. तो वो, so who used to tell me I'll die without you, and suddenly when I got married, my dolly didn't go home, it went to a hotel. Over there, the first dialogue my husband spoke was that I'm going to throw you out. The kind of dowry your parents have given. Do you think हम इतने छोटे बंदे थे जो ये आपने दहेज देके शादी किया? I was very naive, very foolish, very emotional. And I thought I'll reform him, like I used to watch in pictures कि बड़ा husband ऐसा है तो उसको वो reform कर लेती है. That kind of attitude. And this child, she was entangled inside of my womb. And they said it's because of some violent, hitting on you, which has caused this. And when she was 10 or 12, she became violent.
Is that when she was diagnosed with paranoid schizophrenia?
When she became violent, and then even then we didn't go to the psychiatrist. Everybody thought she's stubborn, she's very, बड़ी जिद्दी है, ये है, वो है, थप्पड़ मारो, And when in a joint family, as I've told you before, there were children, they used to reject her. They would not play with her because of her weird behavior. She would hit anybody, she would scratch her younger sister's face. So everybody avoided her. So she didn't think there was anything wrong with her. She thought everybody is being very cruel to me. And she hated everybody. She took so much rejection that she started rejecting everybody. आप कहते हो ना मेरे कोई friends नहीं है now.
So Rani, Sonia being so violent and being diagnosed as a paranoid schizophrenic, Did you want to keep her hidden? What did it embarrass you? Were you ashamed?
Never, never. Not even for a moment I ever felt, because she was always part of me. So the child is part of mother. How can anybody think about a child suffering so much? And I could suffer with her, I could feel her sufferings, and I could never part with her. In between, even when I went to America with a play for 2-3 months, I left her with my mother. And that period, and along with few other periods, I cursed myself that I neglected my child. And she was neglected, because when I got into theatre, I got very much, enamored by the theatre world. And I discovered that I could act, all my pent up, emotions could be let go, and I was enjoying it very much. And she would be around, both my children would be playing around. Even when I was acting or I was directing, they would be around. And but I never hid her, I never kept her away from my friends, I never pretended that I'm not married, I don't have children. Many of my friends, and many a times, they would advise me, Rani, she's also not happy and you are also so embarrassed. Why don't you put her in an institution somewhere, some home? There's lots of stigma in this society, I go to watch a play or a program. There are people, they make so much noise there. They misbehave. Some people use foul language, and that is accepted. But not my child. And everybody will say, "Kyun saath mein le aati hai?" Huh? And one of my very close colleagues, my friend, it was his play, and somebody was taking pictures, and he must have fought it. And she doesn't know. She said, "Oh, usne fought kiya." And I stopped her. Sonia, no. She kept quiet. And I know where to draw a line. If my child is not stopping or is disturbing, I have a habit of getting up and taking her away. I missed the play. But he stopped the play and asked me to take the child out.
Because she used the word fart?
Because she used the word fart. So, I know in my own experience, people have come, लड़ाइयाँ हुई हैं, हाथ तो पाए हुए हैं लोग, वो सब accepted है. But a child who's suffering is not accepted. There is a big stigma in the society, and they throw her, leave her. Why are you spoiling? You're not getting your promotions. You're not getting your limelight. You're not getting pictures. And people said, you know why? Whenever anybody suggests your name, they say, nahi, वो तो अपने बच्चे को साथ लेके आ जाएगी. I said, hell with the chance, I come with a package. If you want me, have me, otherwise no. And even the family, they don't invite me. वो शादी हुई कि उसको मत लेके आना. अभी my brother was here from America, and every day they had a dinner program. But they didn't invite me because Sonia will be around. सोनिया को छोड़ देना, किसी के पास छोड़ देना, उसको बोल दे स्वीप्रेस को इसके पास बैठ जाएगी. नहीं, sorry, I will not enjoy my outing if Sonia is at home. If she is well cared of, my students are there, they are having good pizza and enjoying, then I can go out and have dinner with somebody. But not, I can't leave her behind. Because my problem is that she's part of me.
टूटा टूटा एक परिंदा ऐसे टूटा कि फिर जुड़ ना पाया. लूटा लूटा किसने उसको ऐसे लूटा कि फिर उड़ ना पाया.
I have been diagnosed with borderline personality disorder. I have terrible mood fluctuations. I'm not confident of my decisions because what seems right when I'm up does not seem so when I'm down. I have lost all sense of self and I don't know who I am anymore. I am not like you. Why can't you see? I can't be normal like you want me to be. I am not like you. The smallest things set me off, in the worst way, every day. I used to be able to pretend I was okay. I am not like you. When I try to say what I feel, you don't seem to understand what I'm trying to say. Instead, you twist and turn my thoughts and words, taking them the wrong way. I am not like you. I am slowly drifting away, trying to keep myself together, not doing good in any sort of way. I am not like you.
A recent 3-year study in the UK has pointed out that lack of stability in the home environment, poor primary attachment, and harsh discipline has substantial influence on both the onset and persistence of mental disorder.
Parents are a big trigger. Their lack of understanding does a lot of harm. They impose their career choices on their kids, especially this med and non-med mania. No wonder so many children have breakdowns and become suicidal. Drinking, drugs, they're all part of our coping mechanism to battle depression and anxiety, our sense of low self-worth. Yes, doctor. Tomorrow at 12 is fine. I meet a therapist and I'm on medication as well.
Allah ke bande has de, Allah ke bande, Allah ke bande.
I'm involved in my own treatment because no one else is.
So, what is mental illness? Simply put, it is a medical condition that disrupts a person's thinking, mood, ability to relate to others, and day-to-day activities. With respect to being in touch with reality, mental illness is listed under 2 categories: neurosis and psychosis. Persons with neurosis can understand that they have a problem, but they can't resolve it themselves. Depression, anxiety, OCD, mood swings are some examples. Persons with psychotic disorders like schizophrenia do not understand that they have a problem. They live in a world of delusions and hallucinations. Professor Freeman states that trauma, abuse, or deprivation often play a significant role in psychotic experiences. He further suggests that treatment must not depend solely on medication. In fact, therapies like the so-called talking treatment can often be beneficial. Neo-Freudians Otto Finichel and Kahin Horney point out that interpersonal and social relationships arising out of restricted cultures, childhood conflicts, and emotional experiences are important causes of neurosis. Which means, besides genetics, poor parental bonding, adverse family environment, and stressful life events play a crucial role. Horney emphasizes the human child's hostile reaction towards rejecting parents as a cause of neurotic breakdown.
टूटा टूटा एक परिंदा ऐसे टूटा कि फिर जुड़ ना पाया लूटा लूटा किसने उसको ऐसे लूटा कि फिर उड़ ना पाया ओ अल्लाह के बंदे हंस दे अल्लाह के बंदे अल्लाह के बंदे हंस दे, जो भी हो कल फिर आएगा। टूटा टूटा एक परिंदा ऐसे टूटा कि फिर जुड़ ना पाया। लूटा लूटा किसने उसको ऐसे लूटा कि फिर उड़ ना पाया।
There is a massive scarcity of mental health experts on one hand and a deep stigma in the mindset of people regarding mental health issues on the other. IMA President Dr. K.K. Agarwal says that there are only 6,500 trained psychiatrists in India, and a WHO report points at India having the highest suicide rate in the world.
टुकड़े टुकड़े हो गया था हर सपना जब वो टूटा, टुकड़े टुकड़े हो गया था, टुकड़े टुकड़े हो गया था हर सपना जब वो टूटा। बिखरे टुकड़ों में अल्लाह की मर्जी का मंजर पाएगा। अल्लाह के बंदे हंस दे, अल्लाह के बंदे।
I suffer from OCD. एक ही तरह के विचार बार बार लगातार मेरे दिमाग में आते रहते हैं, ऐसे इरेशनल थॉट्स जिनको मैं चाहकर भी कंट्रोल नहीं कर पाती। It is really very exhausting.
I don't know if I should take my meds. I should take my meds. Should I take my meds today?
The stress of dealing with repetitive, irrational thoughts, the urge to perform meaningless, repetitive actions often leads to a complete breakdown.
It's going to work. The medicines work. I should stay on the medicine. How do I know if the medicines work? I don't know. Should I take
Guilt appears to be a factor as well. It could include the perception of being a bad friend, wife, father, etc., or having forbidden thoughts and feelings. Events, even from the past, which once gave rise to feelings of guilt, can worsen obsessiveness.
I do take pills. मुझे पता है मेडिकेशन बहुत ज़रूरी है, पर सबसे अच्छी बात ये है कि मेरी फैमिली मुझे पूरी तरह से सपोर्ट करती है। हाँ माँ, राम राम माँ। हाँ जी, मैं ठीक हूँ माँ, बिल्कुल ठीक हूँ। ऑफिस में थी, हाँ काम कर रही थी। ठीक है, शाम राम राम माँ। और मेरी फैमिली की सपोर्ट के बिना मैं एक नॉर्मल प्रोडक्टिव लाइफ जी ही नहीं सकती थी। I do enjoy my job and I have colleagues too. पर mental health issues colleagues से discuss करना, mental health is a huge stigma and stigma is far more disabling than the disease.
टूटा टूटा एक परिंदा ऐसे टूटा कि फिर जुड़ ना पाया। लूटा लूटा किसने उसको।
And this ignorance, this lack of understanding by the people is the first problem that needs to be tackled. Because stigma prevents those suffering from mental health issues from seeking help. Stigma opens them up to bullying, harassment, even physical violence. Stigma makes them believe that they can never succeed. Stigma needs to be eliminated from the minds of at least the family members, because family support is crucial. It may mean the difference between carrying on with life or giving up on it.
हमने भी तेरे हर एक गम को गले से लगाया है ना ऐ जिंदगी गले लगा ले।
So, Dr. Basu, we are a country of 1.34 billion people. Yet we have around 6,500 psychiatrists, if not less, in our country. So what is the reason of this dearth of psychiatrists?
I mean, there are multiple reasons at different levels, but one of the major important reason I feel is the lack of focus or lack of emphasis which is due for psychiatry as a discipline. So what happens is that even at the medical level, some people feel that psychiatry is a subject which is to be taken at the very end in case a person does not get into the so-called more prestigious subjects like medicine, surgery, obstetrics, etc. But at a higher level and at a very important level at the government, at the policy making, at the funding, at the budgetary, those kind of levels, it is often seen that mental health is something which comes lower after malaria control and tuberculosis control, which are all very important, no doubt about that. But that kind of a mindset of mental health coming lower in the priority, that badly affects the mindset of everybody who is into it.
So what is the solution? What needs to be done about this? How do we get more people into psychiatry?
Well, gradually that mindset needs to change. We need to talk more about mental health being a very important issue, as important as, and in certain cases perhaps more important than physical health issues. So that has to come again at multiple levels, very importantly from the top level, government level, but also at the teaching training level, even from, I would say, can start as early as the school college level, where there is that kind of an awareness coming up that mental health is an important issue, and hence people will perhaps feel more motivated to take up psychiatry as a discipline.
And what I get to hear is, and correct me if I'm wrong, that the model that is used in our country is inadequate because the patient is immediately prescribed some sort of medication.
Our model is primarily medication focused. Counseling, simple things about living a healthy lifestyle, getting adequate sleep, getting some physical exercise, taking healthy food, those kind of things, talking with your parents rather than spending the entire time on Facebook, meeting up for a family dinner, such small kind of things which are very important and which can and always be done along with counseling. That talking part, in a very layman's language, the talking therapy, that is something which is an unavoidable integral part of that, and that's where often we are sadly lacking.
So, do you think counseling children, parents, making them aware of psychiatric issues in schools, is that something that needs to be introduced?
Absolutely. What we really need is at a systematic approach for every school, college to be covered with mental health awareness, counseling, and a kind of a destigmatization. Nowadays, everything is brushed under the carpet, both at the family level, at the children's or youth's own level, and also even from the school college level. That needs to change, and for that again we all need to come together, the society, NGOs, government, and teacher, student, families all together. I guess that's one way out.
In a study conducted by PGI in 1998 in government and private schools, children as young as 4 and 5 were found to be suffering from anxiety. But of even deeper concern is the Great Smoky Mountain study regarding subsyndromal anxiety present in children and adolescents. Subsyndromal anxiety is when children have anxiety symptoms but as yet do not fulfill the criteria for any anxiety disorder. The study shows that it quadruples the likelihood of children without any previous history of anxiety developing anxiety disorders in the future. Counseling is one of the few options for reducing chronicity, and it is therefore imperative that our education system addresses this problem and sensitizes parents and students. Information and knowledge will help all concerned become aware of trigger situations, lead to building appropriate coping mechanisms, and ultimately reduce at-risk and suicidal behavior.
Perhaps if I had realized in school that my mood swings and outbursts were part of a bigger problem. Perhaps if my parents had some idea I could have learned to manage myself better, not been in so much pain.
Mental disorders are caused by a complex interaction of biological, social, environmental, cultural and economic factors. A 2013 Lancet study revealed that 31 million years of healthy, productive life was lost in India to mental illness. By 2025, this will increase to 38.1 million. India accounts for 15% of global substance use, neurological and mental disorder burden. And yet, our budget allocation for mental health is shameful. MP Mr. Konda V. Reddy had pointed out during a parliamentary debate that the union health budget was 2.2% of the overall budget, of which mental health accounted for only 0.16%. Even Bangladesh, at 0.44%, allocated more to mental health than India.
If you translate it, the budget for mental health will be 0.0036. The minister can correct me on this, but if it is so low, how can we really implement this?
है जिंदगी गले लगा ले, है जिंदगी गले लगा ले, हमने भी तेरे हर एक गम को गले से लगाया है ना, है जिंदगी गले लगा ले, है जिंदगी.
Hi.
Karan, I wanted to ask you about your life. I wanted you to talk a little bit about yourself and your son, Atul.
I'm 77 and a half today. I got married in 1966. After 2 days I realized there is something very wrong with my wife. So went to the doctor, psychiatrist, late person age. So he said, your wife is suffering from a serious mental illness. It's known as schizophrenia.
Suffering from?
Schizophrenia.
Right.
Well, you can't make out anything because it was all up and down. Normal sometimes abnormal. The marriage ended in a divorce. Son was with me. My son got this problem from her. He's bipolar. He's 55 today. His IQ is 147, which is a very high IQ. But he stopped going into a maniac phase. He stays into a depressive phase more, as he realizes today. That, well, he's nothing. He's got no job. He's not earning any money. He's under treatment.
So he's on medication.
He's on medication. You can't do without it. You have to be on medication. If he doesn't take medicine for 3 days, things will go absolutely away. You can't control it. See, this problem doesn't start when you're 15, 16. It starts when you are young. But we don't realize it, that this is some problem. We think कि बच्चा है ठीक हो जाए. And as the child grows, फिर कहते शादी करो, शादी के बाद ठीक हो जाए. Only then the problem starts. When they say there's something much more. Then we go to a tantric, when we go to all these stupid people. Before we go, finally things are out of control. Then we go to a psychiatrist. Whereas, it's all due to lack of awareness. You see our movies, पागल है, पत्थर मार रहे हैं.
Right.
It's a fact.
So you must have gone around the country looking at institutes.
Yes, I have visited practically all the halfway homes in the country. In Chennai, in Bangalore, in Bombay, Pune, Valsad. And well, there are 14 mental hospitals which were basically in a very sad state. They are overcrowded. The capacity is 500 people, there are 4,000 people there. WHO report says that by 2020, 25% of our population will suffer from mental sickness. Till that time, some ministers or some MPs and MLAs, children don't have this very problem. Nothing going to happen in this country because they are not affected.
So Colonel Mendiratha, you're speaking so much from the heart. So if you had to speak to a government official right now, what would you tell?
What I want is that this issue has been neglected for decades together by the government. The money is there, it is refunded back, it is surrendered for mental health. I know it. 600 crores was surrendered 10 years back. Even now it is being done. Whatever we have in the world today, people landing on the moon, people doing everything. Look at all the mobile phones which come. Who has done it? It's the brain which has done it. But when the brain goes sick, it doesn't function properly. Why do we neglect it and why do we give it a stigma and say pagal? So the society or the government didn't realize it. What we want is safe, humane, halfway homes where our children are treated with dignity when we are no more. We need rehabilitation centers. We need playgrounds which are specially meant for them. This is the biggest issue which goes. Money is not an issue. Who will look after my son? Who will make sure that he takes his medicine? Same thing is applicable with every parent who has a son or a daughter. That's what I want.
Well, where do I go? Can I just pray to God? I have been to all institutions in India, the best of institutions, the best of hospitals, the best of doctors. And I find everywhere things are lacking. There are so many patients and one doctor treating 100 patients, 90, 80 patients. And then, they can't cope up.
So where have you been?
And I have been, you name an institution, starting from PGI in Chandigarh, then going to the National Institute of Mental Health in Bangalore. I don't blame any doctor. Please kindly never ever quote me. All doctors are very competent. There are ailments. We talk about cancer, we talk about serious ailments. But I think this is the most serious ailment. And the government is not doing much for it. I take care of my child. Yes, I refuse to part with her. I refuse to put her in a home. There are so-called homes, they are so badly kept. Even if you are normal, you go and stay there for 2 days, you will develop mental sickness over there. The atmosphere is so morbid, it's so depressing.
So Rani, what do you expect from the government? What do you want them to do?
The government, first of all, increase the number of doctors in these institutions. And they should design the whole, programming of treating a patient with heart and soul. 9 months I spent in NIMHAS. Again I say, I don't blame the doctors, I don't blame the institutions, but there is dearth of doctors, their funds are very little, The maintenance of the rooms, they can't afford to have better than what they had, Those, the maids are not trained, the nurses are not so well trained. So all these things put together, I was disgusted. Because my child could not get a home. So I want the government, above all, should think about the mental health of the country. And I demand it from the government. I have a right to demand that. I pay the tax. And I am a very patriotic nationalist. I'm a citizen of this country, and I have all the right to ask that there should be some place for my child when she is taken care of by the experts, the people who can cure her, because we have not given her a chance to be cured. I feel they should concentrate not only on the hospitals, but there should be homes for such people, very comforting. There should be therapists over there, occupational therapists, There should be games, there should be music, there should be teachers, paintings. My daughter draws beautifully. And she has that talent in her. She sings beautifully.
Piu, piu, karata, papi, hara, bole.
I get up in the morning, every morning. I sleep at night, every night, with a prayer in my heart. Oh God, please show me a path, show me a place where my child is happy and comfortable. And what after me? What will happen to her after me? Don't let me die when she is alive. You know, I keep on imagining things. And एक शेर है ना, अब तो घबरा के ये कहते हैं कि मर जाएंगे, मर के भी चैन न पाया तो किधर जाएंगे. So if I die before her, मैं उधर तड़पती होंगी, उसको देखूंगी कि she is neglected, she is lying in a hospital or in a closed ward. So this is something that shatters me. The thing is, this shatters me.
It is this question that is troubling and angering friends and family of those afflicted with mental disability. The government must, out of a profound sense of duty for its citizens, provide for better facilities than those existing, for it is their responsibility and our right. Mental disability is not the end of life. Most of the time, just like other diseases and ailments, it is treatable. The mad, bad, and dangerous label attached to mental disorders has to be erased. With good institutes and facilities, enough psychiatrists and psychologists, and the right type of medication and counseling, who knows how many extraordinary minds can be saved?